Assalamu alaikum and very good afternoon to all the audience there. There is no one size fits all definition for women health. Woman is all about strength, inspiration, power, guidance. A mother, a wife, a daughter, a friend, and a sister. I'm Dr. Asya with you from Prime Health, and on this International Women's Day, Prime Health chooses to discuss and let our all beautiful women to know about the most important health topics. Staying healthy can be challenging for homemakers or professional women, especially when life gets busy. By brushing up on some important health issues and how to prevent them, you can help yourself and family to live a more productive lives now and for years to come. As we at Prime believe in inspiring, educating, and empowering women to lead their best lives in more than one way, we choose to talk about heart health, we choose to talk about gynecological health, and we choose to talk about skin health issues. With this, it gives me immense happiness to introduce our first speaker of the day, Dr. Azza Ghazalian, specialist cardiologist at Prime Health and practicing cardiologist at Prime Medical Center, Mizhar branch. She has an extensive experience of more than 22 years, which includes all non-invasive cardiovascular diseases. Good afternoon, Dr. Azza.
Yes, good afternoon. Assalamu alaikum.
Walaikum assalam. Good to see you, doctor.
Me too.
I would like to introduce our second speaker of the day, Dr. Nusrat. Dr. Nusrat is a specialist gynecologist and obstetrics for experience for more than 11 years in this field at Prime Health, and also practicing at Prime Medical Center, Barsha branch, which includes her expertise is, of course, not limited to all high-risk pregnancies, infertility, screenings, hysteroscopies, all major cesarean sections, or benign gynecological issues, and the list goes on. Good afternoon, Dr. Nusrat.
Good afternoon, Dr. Azia. Thank you for having me.
Thank you. Thank you for joining us for this session today. Of course, our third speaker, everybody knows her, our Dr. Mayada Magdi. She is not only the specialist dermatologist with extensive experience of more than 16 years, she's also the medical director at Prime Health, Prime Medical Center, Mizhar branch, and her expertise is endless. I would like to at least mention 5 of them, which includes all kind of laser surgeries, mesotherapies, or PRP. So today I'm also personally going to at least know about more of the skin and hair issues from our Dr. Maida. We welcome you, Dr. Maida, on the program for today.
Thank you, Dr. Asha, for including me in the very special day, which is the Women's Day. And happy Women's Day for all of us and all the women all over the world.
Thank you for that. So as we have chosen 3 topics, I would like to start my first question with Dr. Azza about overall impact, or about the truth about women and heart health. Though we all know that men are mostly diagnosed with heart issues or cardiac arrest or cardiac problems, but I want Dr. Azza to tell us that what is the truth about women and heart health, and who are the women at risk for heart diseases. Dr. Azza, we would like to know from you, please.
Yes, Assalamu alaikum. It gives me a great pleasure in the Women's Day to tell you about what is important about the health of the heart and the cardiovascular system in general for the women. To know, the women's heart is smaller and less in weight than the men's heart, and it pumps faster and it ejects less volume of blood by 10% than the volume in the men. When the woman is exposed to stress, she reacts by increasing her heart rate and blood volume. On the other hand, men respond to stress by vasoconstriction of the arteries and elevating the blood pressure. Thanks God we don't react like that. Regarding the women, Allah gave them a good thing which protect them against cardiovascular disease in the perimenopause period, which is the hormone estrogen. After menopause, the women became as equal as men in getting cardiovascular disease. So the woman can protect herself by following special instructions, which is important, like lifestyle modification. Which woman is at more risk for cardiovascular disease? To tell in the premenopausal period, those women who are getting problems with pregnancy, like pregnancy-induced preeclampsia, eclampsia, diabetes, those with endometriosis, those are getting bad habits like smoking, not exercising, not following a healthy diet, and have hyperlipidemia. So very easy, we can protect ourselves from cardiovascular disease by following a good healthy diet rich in vegetables, fresh fruits, avoid consuming the red meat, and try to decrease the fat, unsaturated fats in our food. Try to exercise by brisk walking 30 minutes daily, if not at least 3 to 5 days a week. And try to avoid passive and active smoking because it seems equal in have cardiovascular disease. And try to manage stress, not to avoid because it is unavoidable, but try to practice things which help to alleviate the stress. And regarding the infections and exposure to disease today, uh, healthy diet, exercise, drinking a lot of water, and trying to consume fresh foods and be away from the fast food. I think this will be good if we are all following. Inshallah, Allah will protect us. And I hope
Inshallah.
for you all a good heart and healthy heart.
Yeah. Doctor, I would like to know precisely if we have to define who are the women at risk, who are the women who should come for screening, and what kind of screening we suggest to women to check if their heart is healthy or not.
Okay, because hypertension is a silent disease, so the woman cannot know if she is really hypertensive or not unless she visits the clinic to the general practitioner. If the blood pressure is elevated, she has to start immediately. Following healthy diet, decrease the salt in food, drink enough water, and exercise regularly. We need to keep the blood pressure 120/80 at least. It doesn't have any other comorbidities or other diseases. Again, for diabetes, maybe with the GP, also the general practitioner, they can do routine workup like blood sugar analysis to realize or diagnose early diabetes. And of course, we can advise about smoking, consuming alcohol, and these things.
Absolutely, doctor. And what are the tests like? For example, one of any of the patient, for example, woman ranging from 20 to 50, and she has never visited a doctor and would like to proceed for heart health checkup. So, what is the suggestion from your side, and what is the recommendation, and how do we check at least the basic things?
For laboratory investigations, we can do simple fasting blood sugar, fasting lipid profile, including the different types of cholesterol and triglycerides also. Of course, measuring the blood pressure. We can do a simple ECG. It can show if there is any problems in the heart, like chamber enlargement or any hypertrophy, without going into sophisticated investigations. We can take the body mass index simply by taking the waist, the height, and the body weight, and see if what we have is very serious condition in those females below the age of the menopausal age, which we call the metabolic syndrome, which is something very dangerous and make the female more susceptible for cardiovascular disease even before the menopausal period. And this includes a little bit elevated systolic blood pressure, fasting blood sugar to be a little bit high, and of course the triglycerides become high. So we can diagnose this early, manage properly, and then we can avoid future complications.
And doctor, does women really come to you with any kind of signs and symptoms? I mean, overall in the OPD, and we do find out certain diseases, or it's mostly the silent signs and symptoms, and we never get to know unless we proceed for any blood check or any screening further.
Actually, females, they don't manifest, especially in the older age, not the younger age, with the symptoms which are suggestive of serious cardiovascular disease. Because females, they have high threshold for pain. They don't express the chest pain like males. They can express it as fatigue, as nausea, as weakness, shortness of breath, sometimes even palpitation or abnormal heartbeats. So simply by asking questions and taking very good history about and the analysis of the complaints, and of course examination, doing ECG, taking the family history, we can put the patient in the category if she is low risk, intermediate risk, or high risk for cardiovascular disease, and we can proceed for further workup accordingly.
Absolutely, Dr. Azza. I think it was quite precise. So, all women, please listen to the Dr. Azza's advice. It's about symptoms, whether it is there or not. Look for your family history, look for your BMI, and do visit your primary physician, if not the specialist. So, we recommend that. With that, I would like to proceed to our next speaker, Dr. Nusrat. Her expertise in the field of gynecology and obstetrics. Doctor, I would like to start with basics and probably a quick revision about breast health and cervical health. With it will be great.
Thank you, Dr. Asif, for asking this question. To start with, breast health is very important, and 1 in 5 women have problems with breast. There's no specific age to start screening with, but after 50 years, the screening is must. But if you have a family history of breast cancer, then it's very much important that you go for a regular screening from 25 years. And for women who don't have any history of family cancers or anything specific, you can start doing a self-examination at home, which would be you can do it in a shower after your menstrual period, when your menses have been finished, and with the help of your palm, you can try seeing for any nodules in the breast in a circular fashion in the both the breast, with the left or the right breast. And if you find any lesion, and just try, if small nodules are very common in breast in a reproductive age group, but if you feel that they are painful or the pain is radiating towards your armpit, anything like that, you will require a further ultrasound. And in women who have a family history of breast cancer, regular screening of the breast is required. And once you have finished your family, bilateral mastectomy also may be advised in case you have any faulty genes that would be in concern to breast cancer. Then coming to cervical cancer, which is screening, which is regularly done for all women. It starts at 25 years and it's done every 3 years. And we do a screening, which is an examination, and we take a small sample from the neck of the uterus and we send it to see if there's any abnormal cells. And we also check for a virus called as human papilloma virus, which is a sexually transmitted virus. And we can also prevent, like there are a lot of studies which have shown that vaccines can help, which is a Cerverax vaccine, which can be taken. And it's 3-dose vaccine. So screening has to continue from 25 years till 50 years, every 3 years. And furthermore, after that, it will be every 5 years. And every woman should go through screening. And coming to menstrual health, everyone has a pattern of menstrual cycle. Some people feel the cycle is 28 days, to some it is 35 days. So that the cycle length can vary depending on your genetics and your mother's. You get this all genes from your mother, so you can change. The things can change according to your mother's nature. And in case if the cycles are too lengthy or the bleeding is too much, where you're changing more than 4 pads a day, and you're feeling that you're getting too tired and fatigued, it means you're bleeding more in the cycles, and you require a checkup. For that, you will require an ultrasound and examination in the clinic to see if there's anything else we have to take care. And if the bleeding is too much, you may require some medications to help you with that, and some iron supplements. So that would be precisely your breast, cervical, and menstrual health.
Thank you, Doctor. I have some questions to ask at this point of time. Since we talk about breast health overall, do really women like to get themselves checked when they come for other gynecological issues, or it's only us who will encourage them to do so?
I always make a point to ask them how much are they aware about the self-examination of breast, so that they're aware that it has to be taken care. Because 1 in 5 women do get end up having breast problems, breast tumors, and all. So you should always make sure to ask. We always make sure that we ask a point about that, and I surely ask them if they have any pain and anything they feel anything unusual, if there's any change in the color of the skin, or there's any punctuations or any discharge abnormal from the nipples. These all are red flag signs to see that there is something abnormal happening and it needs to be taken care. And if anything of this sort is there, I always tell them these are red flag signs and they have to come back to us immediately so that we can take care. But they should always watch out for all these things.
Absolutely, doctor. My second question to you as well is that, mammography overall, there is a huge concept behind this, or I'll say misconception, as we are proceeding towards different world. This is an era of pandemic. We try and gain a lot of knowledge from Google or other internet resources. But I really want to know our women the proper recommendation for mammogram, and what age does it really require any age bar, and how frequently we can go for mammogram, and actually what is mammogram and what are the risk factors associated with it?
As we go with investigations in breast lesions, ultrasound has its own pros and cons. So it misses around 20% of lesions. Well, mammogram is also not 100% sure. It also misses around 5 to 10% of lesions. So what we do in mammogram is anyone who is more than 40 years who had any lesion which was suspicious, and we grade them into lesions of suspicious, benign, and if it had a suspicious lesion, we usually advise them to have at least mammogram once in 2 years. But if they have a family history, then they should get a mammogram and an ultrasound so that it's a foolproof method where you don't miss out any lesions. Because every investigation does has its own false positive points. So we have to make sure that if you have a family history, you should do both the investigations. But if not, then if you have a lesion, then mammogram once in 2 years wouldn't be enough.
Absolutely.
That would suffice for us.
Yeah, and coming back to the cervical health and cervical vaccine, what we are recommending, what is the age we can start the cervical vaccination, and is it only for girls or boys can also? I mean, have read somewhere. I wanted to know from you. Boys are also recommended to take this vaccination.
Yes, Dr. Asya. Actually, the new cervical vaccine, which is called as Gardasil, covers 4 strains of human papilloma virus, and it is recommended in both the boys and girls. And for girls, it starts from 9 years, and they can take up till 15 years. For boys, it is from 11 to 16 years. As you know that it causes cervical cancer in females, but it also causes some amount of perineal tags and risk of other skin lesions in boys as well. So Absolutely. It is recommended for both boys and girls to undergo the immunization.
Right. Thank you, doctor, for that. Quickly on the menstruation part, the most common complaint what women always suffer is dysmenorrhea, or we can say painful periods. If you can tell us that, what are the red flag signs when we should not as women ignore, and we should definitely go to the doctor? Because as Dr. Azza correctly said, the threshold of pain for women is always high. So we tend to delay things and we don't get back to our doctors. We don't seek the specialist opinion, and when it can be really dangerous. So quickly on that part will be of great help.
Yes, Dr. Asya and doctors, I completely agree. Women tend to push out their problems and they think that will get better. See, if we have a periods which is not painful and suddenly we develop painful periods, and you have pain which is starting at least 2 days before the periods and continues for at least a week after your periods, it means there's something which has to be investigated and seen. Because there's a possibility you may have an ovarian cyst or any infection which has caused some problems in the uterus. In those situations where your pain has newly occurred when it was not there before, in those situations you will require to make sure that you need to be checked.
Okay. Thank you, doctor, for that all insights. Now I would like to proceed to our third speaker, Dr. Meada. Given that the skin is our largest organ of the human body, and it really needs to be taken care, and directly I would like to know from doctor the truth about women and skin secrets. Even if this question is actually, this topic is, even if it takes maybe more than 24 hours to compile one topic in skin health, as the world is all about dermatology. The world is about so many procedures, and world really requires this. So what is that truth, what women and should know about skin and hair issues?
Yeah, actually, this topic, as you mentioned, Dr. Asia, is very long topics. We can spend like days to talk about the skincare. But what I want to tell every woman, she have to take care of her skin, because the skin is the largest organ of the body, and it's like the mirror of what's inside. So with seeing some symptoms in the skin and signs, we can diagnose the internal disease, even internal disease like diabetes. Sometimes we are discovering from frequent bacterial infection, we can suggest maybe there is underlying diabetes there. So a cancerous negligence, which is coming in the neck. Sometimes the people are coming, or the women especially, coming to complain about the pigmentation. But we actually can discover it's not just a pigmentation, it's endocrinal problem, either polycystic ovary or diabetes or whatever. So by some skin disease, we can discover internal disease. We can do a blood test to investigate what is the role behind, what is this symptom is indicating for some systemic manifestation, even the thyroid as well. Another thing, taking care of the skin is the major or the hot topics every day. Every woman want to be beautiful and want to look more younger and more healthier. So they have to take care of their skin by certain kind of skin routine. We are advising every woman above 24, even above 20, to take care of her skin if she don't have any issue. But if she have any issue, she have to treat this issue like acne according to the age. According to the age, you have to take care of the problem. And the simple skin routine by using simple cleanser, moisturizer, sunscreen, or morning and night routine, it will be also a very helpful for her skin. And also the body, taking care of the body by using moisturizer, and take care of the hair, because we are actually, hair, skin and nail is very important to every woman. She want to have a nice hair, she want to enjoy her beautiful skin, her look and everything. So the skin is not only a skin, we can discover a lot of skin disease from the skin, and also we can take care of the skin by skincare routine, which is giving us the more beautiful appearance or more glowing skin.
Absolutely, doctor. I think back-to-back questions for your topic is that uh, uh, what is good sunscreen, and do we need to wear it indoors or only when we are going out, and what is the recommendation?
See, the sunscreen is very important. It's not only protection from sun; it gives us a lot of advantage for the people who is complaining of pigmentation. It can prevent the darkening of the pigmentation. So this is very important. It's also important as a photo aging. For the photo aging, our exposure to the sun is just not only exposure. We are exposing it by cumulative effect of the sun, can affect our collagen, our elastin, our skin color itself. So with a photo protection, you can protect your skin from the photo aging and from the pigmentation. Some photosensitive disease. There is a lot of photosensitive disease can increase with sun exposure. So it's not only like luxurious things you can imagine it's a luxurious things, it's just for protection. No, it can protect you from the photosensitive disease. Some people come complaining of the urticaria or photosensitivity. Once they are exposing to the sun, there will be urticaria rash all over the face and exposed area. So it's not only as a protection, it can also be part of treatment. As photosensitive disease, prevent further pigmentations, decrease the harmful cumulative effect of sun exposure and heat. It's not only direct sun exposure. Some of the people thinking that it's only sun exposure, direct sun exposure, but even inside, because of the lights, and as our meeting now, we have a lot of lights, we have computer, we are sitting in front of computer for a long time. So this rays, all of these rays affect your collagen and elastin. So you have to apply sunscreen, and it's recommended to apply it each 2 hours if you are outdoors. But if you are indoor, you can spacing the timing. And also for the housewife, sometimes they are telling, I'm always at home, but she's cooking and in front of the heat. So with exposure to the heat, even during the cooking, she has to also apply sunscreen. If she's complaining of certain skin condition like acne, like rosacea, the sun exposure or only heat exposure can flare her condition. So the sunscreen is part of treatment of a lot of skin disease, and as well as a protection for the sun damage and aging. So it's very important to put in our consideration as daily routine.
And this is for men also.
Of
Right?
course, yeah, but
Of
they are
course.
not happy to apply creams. But actually, if they are complaining of certain condition like pigmentation or acne, or taking medication like isotretinoin, they have to apply sunscreen. If they are complaining of photosensitive disease, also they have to apply sunscreen. And the recommendation for sunscreen must be above 35. It's not only like morning cream. For some ladies, they are taking SPF or the protection factor 15. It must be above 35. We are recommending, because we are sitting in a hot country. So it's not only 35 or 15 is giving us a protection, but it's better. We are recommending in our daily prescription above 50. Other than above 50, it's all the same. There is very little tiny difference between them. So it's recommended to use a sunscreen suitable for skin, like the acne skin, different than the dry skin. Dry skin, we are recommending the cream. Acne skin, we are recommending oil-free sunscreen. The pigmentation, there's certain kind of sunscreen has certain components to guard against pigmentation. So we have also to go for the consultations first, because not all the sunscreen is suitable for your skin. So you have to always take the consultation from the specialist. Then you can go to proceed for your daily care routine.
Absolutely, I think all the women out there will be very happy, and I hope men who are listening to us will also apply sunscreen as recommended by you, Doctor. We have received a pre-webinar. We have received a lot of questions, and one of the questions repeatedly asked is about what is mesotherapy and who are the people who goes for it. So, quick one, if you can address to that.
Okay, I will give you a quick hint about the cosmetic procedures that's available in the market, or we can do it in the clinic as well. There is a lot of things, either injectable or non-injectable. Non-injectable mean the cream that you can apply at home as a daily care routine, but the injectable is and laser. This is the things that we can offer it in the clinic. Mesotherapy is like vitamins, certain kind of vitamins with certain collection, like according to the complaint. Like pigmentation, we are using some kind of the product like vitamin C, glutathione, tranexamic acid. Recently we are putting it in the cocktail of the mesotherapy. This mesotherapy is a general name. We can address according to the complaint, either pigmentation or under eye pigmentation, or even for the hair falling. And it's a cocktail of vitamin. It can be injected, and to get the benefit of it, you have to do it every 2 weeks. And usually we need 4 sessions or maybe more than that. And the cocktail is different according to the complaint. The other things that we can offer it other than the mesotherapy is the PRP, which is the plasma that we can take it from the blood and take the plasma and inject it all over the face, under eye. It's giving glowing, and it can improve the acne scar also. We can combine it with microneedling. We can do the PRP also for the hair falling. And it has role also as a medical role in the orthopedic things. Other than that, we can use the filler, Botox for the wrinkles and fine lines. And of course, we cannot forget the lasers and radio frequency, which can give us improvement of our skin and also tightening and the glowing. So all of these things is there, all the cosmetic procedures. First, we have to address our complaint. Then after that, we can put a treatment plan. Either we will go for mesotherapy or PRP or lasers. It must be a plan. We cannot just choose one thing and we are thinking that it will give me everything. No treatment will suit everybody, and no treatment will be applied for any complaint and get rid of all the complaint by only one procedure. So I'm believing on combination treatment, skincare routine plus the procedures, and according to the complaint, we can sit during the consultation and put the plan for the procedures that we can offer to get rid of this complaint.
Absolutely, whether this is medical or aesthetic, we should always seek the guidance from the specialist, as Dr. Mayada correctly said. The quick one, doctor, I want to know about what is normal hair fall and when it should really worry a woman. And also, if you
Yeah,
can quickly talk about dandruff issues, skin
yeah,
scaly issues. I know the topic is very huge, but we have received certain questions and we would like to know from you.
yeah. See, the hair falling is a hot topic, and without diagnosing the case, we cannot give a good treatment for it. So my advice is we have to sit the first sitting during the consultation to ask about a lot of things regarding the hair falling. What is this causes is, first of all, the diet. We are asking about the diet. Any manifestations of vitamin deficiency, we can do a list of vitamin tests like iron, ferritin, vitamin D, B12. All of these tests we can do. We can check first during the examinations here in the scalp. Is it this general hair falling, or it's coming, or it is androgenetic alopecia? By help of this dermoscopy, this is the new tool for us. We are considered our stethoscope, which is the dermoscopy. By using this dermoscopy, actually, we can examine the mole and we can examine the hair as well. So we can diagnose if this hair falling is due to multivitamin deficiency or due to fever or stress or operation that the patient previously have, or we can diagnose it as an androgenetic or hormonal problem. So we will go for the hormonal test first, and we will do some hormonal investigation. So first of all, we have to diagnose. Second, if we have any problem in the scalp, maybe there has a lichen planus, psoriasis, any skin issues affecting their scalp, so it is the cause of the hair falling. After checking the clinical and the history from the patient, we address the complaint of the hair falling. We can tell this hair falling due to what? Due to the disease, or due to vitamin deficiency, or due to a skin problem. Then after that, we can discuss the treatment plan. The treatment plan, if we have any vitamin deficiency, we can replace this vitamin deficiency, either iron or vitamin D. Vitamin D is very important role because a lot of people ignoring the role of vitamin D in hair falling. So this is one of the major cause, especially in our Gulf area with a lot of vitamin D deficiency. Then we can take some multivitamins. We can use it for 3 months. Then topical like lotions or hair tonics. And we can go through the procedure that is also helping in the treatment, like mesotherapy, like I mentioned earlier, plasma or PRP we can do. And recently, if the cases is androgenetic or hormonal, we have a new procedure which is calling regenera or stem cell. We are taking bunches of the skin here which contain the stem cell, and we put it in centrifuge, mix it, and try to extract the stem cell. Then we will inject it. We can do this procedure once a year. This is especially for androgenetic alopecia, either for female pattern hair loss or male pattern hair loss. So we have a lot of tools and a lot of treatment for the patient. But first of all, and the most important thing is the diagnosis. So first the diagnosis, then we can go through all of these procedures as I mentioned earlier.
Thank you, doctor, for that extensive knowledge. I'm sure it will benefit all women who are listening to us, as well as the family members. My second question, now as we are in the current, we're still in the pandemic, and COVID-19 is something which has to be a part of all the program. Dr. Azhar, I would like to know that how this COVID-19 has impacted overall the heart health. Earlier, and before 2019, how people used to approach when it used to be heart issues, cholesterol issues, or anything. Are we really losing patients in this current scenario? Is it like, people now we have seen reduction in overall upper respiratory diseases, but we have also seen chronic diseases are growing up. So what is your thought process on that? How did we cope up till now? And what is your recommendation for this COVID-19 still ongoing pandemic for the people?
Okay. Regarding the difference in complications and outcome between males and females for this novel COVID-19 infection, it is good to say, I don't know if it is good or not, but it is good for females to know that the disease is less aggressive Maybe it is something hormonal related, thank God, but it is just going on studies so they can realize if estrogen has a role in decreasing the complications and the manifestations and the severity of disease in other gender. In general,
Absolutely.
those who have previously cardiovascular disease, when they get the COVID-19 infection, actually they become severely sick. So
Yes.
they have to be very cautious because it causes inflammation of the heart muscle. It causes weakness of the heart muscle. It can cause severe and abnormal, dangerous heartbeats. It can lead to the patient or the person to be completely crippled, cannot cope with his daily activities. For patients with high blood pressure, with diabetes, with high lipids, and they are not living a healthy lifestyle, they have to take care and stabilize their condition by following the instructions of precautions first, and then the healthy lifestyle from healthy types of food, from consuming enough water, because many people here they don't drink enough water, and in general we advise for those body weight more than 60 kilograms and less than 85 kilograms to consume like 3 liters per day of water. And those who body weight is more than 85 to consume 4 liters of water. This is very good to maintain at least the blood fluidity and prevent clotting inside the blood vessels. Those with cardiovascular disease, they have to keep their blood pressure within the normal range, not more than 120/80 at the home levels. Of course, in the clinic, the readings will be different. To control the blood sugar, to control the bad cholesterol, try to manage the stress, try to exercise regularly. And those who don't have cardiovascular disease, what they can do is, again, precautions not to get infections from distancing and wearing the mask and avoid contact in crowd areas. And then again, they have to go for general checkup in clinics because some diseases you cannot diagnose until you go to the general practitioner and do some workup. Simply measure your blood pressure, do fasting blood sugar, test your cholesterol level, and then you can realize if there is any health problem. General checkup will help to diagnose early any health problem, manage it, and protect against future complications. Those who got infected with COVID-19, there is a chance to get again the infection, and then the healthy lifestyle and good nutrition, fluid intake, and now the vaccination we have will protect them.
Absolutely, doctor. I would like to know, post-COVID, if people are getting affected with COVID disease, we know what is the nature of the disease and what it causes. And we have also seen people post-COVID have certain symptoms, which also includes, pain or palpitations or tremors and nervousness. So what is the recommendation post-COVID? As of now, I know that we don't have certain guidelines, but as a cardiologist or as a specialist, how frequently people who are already affected with disease before COVID infection, or people who were normal before COVID disease, what is the recommendation for getting at least the basic blood check done or getting themselves checked by the physicians post-quarantine as well?
Yes. For those who have already cardiovascular disease, they have to follow up with the cardiologist to maintain them in a cardiac stable condition, meaning the blood pressure will be very well controlled and there will be no evidence of cardiac decompensation. They will be asymptomatic for abnormal heartbeats, for difficulty in breathing. Difficulty in breathing will be a little confusing because it can be still a manifestation for those who recovered from COVID-19, but still there are some tests we can manage at the level even of the clinic by doing blood test, something like a hormone secreted by the heart muscle in the blood, and it carries normal values. if the problem is not coming from the heart. So we can realize even if the symptoms of the patient is due to the heart problem, or it is a residual symptom from the infection, previous infection. We can do echocardiogram to evaluate the current condition and status of the heart function. We can do simple electrocardiogram in the clinic to follow up if there is any arrhythmias. We can do the blood test to see if the patient is clinically stable or not. Like if the heart muscle is damaged, there will be a rise of what we call cardiac enzymes in the blood test. So still there are things we can do and realize. Some tests also are related to the severity of the infection and if it is affecting the heart, and it can lead the patient to be hospitalized even for few days to compensate his condition, like simply the C-reactive protein or the D-dimer. These tests are telling if the patient is still at risk for complications from the COVID-19 or not. In general, precautions, as mentioned by the government everywhere, we know distancing, wearing masks, washing and sterilizing the hands, avoid overcrowd. This is in general. Then good nutrition, healthy nutrition. This increase the immunity and make the person not to get the infection easily. Good mental rest and avoiding or managing stresses. Control the blood pressure, control the blood sugar, control the bad cholesterol, control also the triglycerides because it is an indirect leading cause for cardiovascular disease. And at the end, exercising, walking, brisk walking for 3 to 5 days, if not every day.
Absolutely, the whole world wants to know how we really can handle and tackle stress. Thank you, doctor, for that explanation. Dr. Nusrat, I have the same question. What is the gynecology and obstetric in the what how it impacted you being as a doctor in this specific field? How difficult it was to cope up, and what is the current scenario? Is the mindset of the woman changed? Is it more of the teleconsultation ANC checkup, or we still follow the same guidelines?
Well, Dr. Asya, as Dr. Azhar told, the lifestyle has changed because of the COVID, and most of us are trying to work from home, and we're not able to have a healthy lifestyle. And there's an increased instance of emotional eating, so people end up eating a lot of junk food and anything just to feel more comfortable about the things happening. And there's increased amount of weight gain, and yes, it has increased irregular cycles in women and causing menstrual problems, and people are missing their cervical screening appointments. And I would suggest that women try to do eat as healthy as they can, and there are a lot of exercises which can be done at home, and a lot of regimes which can be followed, and a lot of you can get a lot of exercises which are just home. We do not go to the gym, and women can try to add those to their daily routine. Even 10-15 minutes of morning walk or exercise and some amount of aerobics stretching would help them. uh, a very important thing that we need at this present pandemic is a very positive attitude to what's happening, and we're able to tackle this pandemic, and we know more about the condition now, so taking more precautions. And in case if there's any cervical screening, I would suggest that women taking all the precautions, visit the cervical screening appointments. And if they have menstrual problems like heavy bleeding and all, should not miss the appointments, and try to at least have a teleconsultation so that they can take medications for them, and they don't end up having low iron count. And as far as it comes to the obstetric part, yes, women are coming less for the appointments, as pregnant women are the risk group for coronavirus infection. And I have always advised that they should take more precautions and try to visit clinics at times when the crowd is less and all those things. But yes, things are going on well. They are much better. There's more teleconsultation going on. Yes, in the obstetric part, the women are still coming to the clinic, and I usually advise them to come in non-busy hours to have a consultation in case of antenatal care. But otherwise, teleconsultation is actually helping doctors much to take care of the patients now.
Thank you, Doctor. And in the meantime, I like to request all the audience who are listening to us, if they have any questions, they can write in the comment section, and our specialist will be there to answer. So, moving towards Dr. Mayada, the same question. The dermatology or skin diseases, unfortunately, in the current times, are mostly impacted. But my question to you is that, it's not always about cosmetics. It's also about health, skin diseases and hair diseases, what we should not miss. And sometimes when we restrict, certain specialties due to COVID conditions, and we really want to abide by the laws, and which is, of course, we have to abide by that. What are those diseases where women should really seek opinion from the dermatologist, and they can be really harming? So, for example, a lot of patients, I believe my other speakers will also agree to that we see now increase in tendency of rashes coming and going, and it's one of the major symptoms what we have seen in last 1 year. And any specific thing for that, or any important thing which you would like women not to ignore and come immediately for the treatment?
There is nothing emergency. Actually, some of the cases of COVID-19 manifested by skin manifestation only. So sometimes some rashes, it's a range of skin manifestation or cutaneous manifestation of COVID. I have a lot of researchers and have lectured before about the skin manifestation of COVID, that sometimes we can also diagnose the case of COVID from the skin manifestation, and it's like vague, sometimes associated with nails, sometimes rashes, urticaria, rashes all over the body. Sometimes it's a manifestation either starting with COVID or during the treatment, or even a side effect of medications, or sometimes the rashes can stay after the COVID. But the things is, the important things is that a lot of us, or all of the people right now, all of the world using the sanitizers and the cleanser, which is affecting the skin, especially the people complaining of eczema. So we have a lot of cases coming with hand eczema, which is extensive right now, and sometimes lead to bleeding even. So this case must be treated, and they can come to seek advice from a specialist for it. So we can advise them to use a cleanser and moisturizers for the hand when they are extensively using the skin sanitizers. So this is important things, that we have a lot of cases of eczema. Another important things coming with also COVID, sometimes urticaria, the patient presented with urticaria, so we have to take care of the urticaria associated with COVID as viral infection, so can trigger the urticaria. Another thing which is important, and I'm seeing a lot of patients complaining of hair falling after COVID. Hair falling is a hot an important issue now for every female, as I mentioned earlier. So the hair falling also associated with COVID. A lot of them complaining of hair falling due to this viral and fever associated with the COVID. And lastly, the acne or mask acne. We have a new term now in dermatology which is called mask acne, which is the flaring of the acne due to the wearing the mask for a long time. So we have to give some advice for the using a cotton mask, using a cleanser, a skincare routine for the acne, because it's one of also manifestation of COVID, which is mask acne. So there is a lot of skin terms and a lot of conditions now associated with COVID newly coming to the world of dermatology.
Thank you, Doctor. As I mentioned that pre-webinar, we have received a lot of questions, and some questions I would like to ask the specialist directly. Miss Rafia is asking, my 9-year-old daughter has very bad dandruff. Her skin is dry and gets allergic often. Please suggest a remedy. I believe, Dr. Mayada, this question is for you.
Yeah.
9-year dandruff.
Yeah, 9-year dandruff, usually starting of the oil secreting gland start to secrete. So due to increased oil secretion plus presence of malassezia, which is kind of fungal that is present in over the scalp. So I'm suggesting to use the ketoconazole shampoo. So whatever the brand is, it contains the ketoconazole, which is important to take rid of this malassezia. Or the yeast in the scalp. And if this dandruff is making like crust, we are calling it seborrheic dermatitis, which is kind of a skin eczema. So sometimes we advise the topical steroid lotions or antifungal solution as well. So according to the case, if it is mild, only the shampoo is enough. But if it is not weak, it's a little bit extensive, we have to try the topical steroid and topical antifungal, even sometimes systemic antifungal if it is extensive. So for her daughter, advise only shampoo for this condition.
Thank you, Doctor. Dr. Azhar, I have one question received pre-webinar. Her name is Ms. Dipti Sinha. I suffered through Corona and recovered well, but there are still days I feel extreme fatigue and neck and back pain. I'm taking vitamin C. What else can I do?
If she is completely healthy with no previous cardiovascular disease, it's better to attend the clinic to do some further workup. We have to know if this weakness or fatigue is due to any underlying problem, or it is just weakness due to simply vitamin deficiency, anemia, or other simple things. Usually, the females, they don't symptomatize with the real symptoms. How old is she?
She says around, she has not mentioned the age, but she just has mentioned that she has recovered from COVID and is taking only vitamin C if there is anything she needs to know. I believe you have already answered that she needs to visit and she needs to get herself checked. I think she must be clear with that. Yes.
Because it differs in causes if the age is below 40 or above 40.
Yes, absolutely. So, Ms. Dipti, if you're listening to doctor's advice, kindly visit your primary physician. So, Dr. Nusrat, we have another question from Preeti Thomas. She's saying menopause is a normal cycle of life. Will that stage requires a doctor's consultation in any way? That is one question. And second is, can vitamin D 10,000 international unit be consumed every day for any period of time?
To start with, first of all, menopause is transition from your normal menstrual cycles to a cessation of your menstrual cycles. It's a span from 45 years to 51 years, so it's quite a long span. And lot of women face different types of things. Like some people have irregular cycles, some have irregular spotting. The cycle length may increase or it become heavy. But during this phase, you should always try to seek a doctor's advice. The reason being, you may have mood swings, you may have vaginal dryness, or the bleeding might be heavy. You can take some supplements so this transition can get much easier for you from the normal menstrual cycle to the menopause. And also at this phase, it's observed that women tend to put on a lot of weight, especially on their tummy. So you should always watch out for calories of what you're eating and try to have a more active lifestyle, like at least 30 to 40 minutes of walk every day, at least 5 days a week. And coming to vitamin D, the maintenance dose of vitamin D is 50,000 per week. So you should always check what's the vitamin D, of what level are you. In this part of the world, most of us have a low level of vitamin D. So knowing about that, then you can try to see what kind of dose should be given to you.
Absolutely. So we have another. So Miss Samira Moidin is asking, which day of the cycle do we need to take a scan if the period cycle is very heavy? She's mid-40s.
I would suggest day 5 or 6 when the bleeding has settled in. Then she can come for a transvaginal scan. That would make us have a better idea about the uterus, the lining of the uterus, and the ovaries. And also if there's any other pathology or any other concerns.
Thank you, doctor, for that answer. Dr. Maida, I have a question from Sumaira. Why do I keep getting warts even after they have been removed? I find it bothersome. Second, she's mid-20s. I know we face a lot of hormone disturbances. Do we need to do a lot of tests to know what's making one fat? If so, which tests are very important? I hope the question is clear. She has a lot of complaints also, and mostly she wants to talk about the warts.
The warts, first of all, the warts, why she's keep getting the warts, sometimes the immune system is suppressed against these kind of warts. We have 100 type or 105 type of hemopapillomavirus. So it's many types of hemopapillomavirus. Sometimes the virus can remain in the skin for a very long time, not manifested as wart. So I'm recommending to take zinc to increase her immunity because the zinc is immune stimulant. And also as herbal or home remedies, we can use the black seeds. because it can also increase the immune system. But once the virus is there, we have to treat it by other methods like topical salicylic acid or lactic acid, or cryotherapies that we can offer it in the clinic, or cautery, whatever the methods of even lasers, whatever the method of treatment. But we cannot give her explanation. It's sometimes genetic. Maybe the body is immune depressed for this virus specifically. And sometimes the virus is remaining for the skin for long times and it is not manifested. So it is, and also sometimes if she's doing treatment, the virus is still dormant. It's not shown. So we have to be sure that the virus completely eradicated from the skin. And what about the other questions?
The question is that she's mid-40s and wants to know if we face a lot of hormonal disturbances. Do we need to do a lot of tests to know what's making one fat? So I believe it's more about obesity and probably high BMI.
Yeah,
so I would like to answer that. Yeah, I think absolutely. I think I would like to answer that. See, a high BMI, definitely, as Dr. Azza correctly said, metabolic syndrome, we have to look for all the other possibilities. Get yourself checked, get your, maybe a diet and nutrition advice will be of great help. And if you reduce weight, the chances of getting into chronic disease and other things what you're inclined to will also reduce. So dietitian and nutritionist along with the specialist will be of a great help and choice. One more question I have for Dr. Maida. She is Sheikha bin Umair. How to maintain the skin after a course of Accutane?
Yeah, this is very important because there are a lot of people ignoring the role of topical cream after finishing Accutane. Accutane is give us a very good and nice effect, but it is not granted that there is no more flare of acne. So sometimes the people can take even up to 5 courses of Accutane if they are genetically predisposed to acne. So for the completing the course and taking the correct dose with correct cumulative dose calculated by her doctor, then after that, after finishing the course and finishing the right dose according to her weight as well, she must continue on topical medications like topical retinoid, which is the topical form of isotretinoin or Accutane, topical form like Accutane or the peeling creams. And also sometimes there is post-inflammatory hyperpigmentation. We advising the creams for whitening, and also keep using the skincare routine like skin cleanser, mask for acne. So keep yourself keep yourself applying this kind of medication because you are prone to acne. So you have to continue the acne care routine after Accutane. Then sometimes we are advising them according if they have pigmentation or anything to continue like peeling or PRP sessions to have a complete effect of Accutane after finishing the tablet or the course of medication.
Thank you, Dr. Maida. As we're proceeding towards the end of the session, it was really great for me and an honor for me to exchange thoughts with my colleagues, with my seniors. I would like to hear from, we have received a lot of appreciations and thank you notes from the audience, and thank you very much for that. And we would like to hear from the speakers take-home message quickly so that we can proceed towards the end of the session. Take-home message from Dr. Azza, please.
I think don't underestimate simple complaints or symptoms like palpitation or awareness of heartbeats, feeling weak or gets easy fatigue, or having dizziness or chest pain or difficulty in breathing. It's better to schedule an appointment with a GP, and then they can realize by simple workup if it is something simple can be managed, or it's better to refer to the specialist.
Thank you, Dr. Nusrat.
Have a good heart.
Yeah, true. Dr. Nusrat.
I would like to conclude saying that in this mid of pandemic, we should try to focus more on our health. The pandemic has made us realize that our health comes first. So we need to concentrate more on our health. And as being women, I think we are the backbone for almost the whole society and the family, and we should concentrate on our health as well. Absolutely. That's what I would say.
Thank you, Dr. Nusrat. Dr. Maida.
I want to tell every woman, take care of her skin, take care of her beauty, and you have to no, don't ignore the minor things. You are not half of the world, you are all the world. You are the mother and the person who are taking care of everything. So take care of your skin, take care of your health, and keep shining and glowing every day.
And thank you all for giving your time and expert advice. And I would like to tell my audience, please take care of your health. Please maintain a good health hygiene, maintain a good healthy hygiene, sleep, take food on time, exercise regularly, enjoy your meal plans, screening timely and timely follow up. Please don't Google every time. Health is a concern. Health is all about knowing it from the specialist, knowing it from the people who are there for you. Listen to them and take their advices as they recommend. Take care of your health, and I wish you a very happy International Women's Day from Prime Health. We are going to come on 11th of March again with our new webinar on World Kidney Day, more from our specialist for you. Till then, stay healthy and stay blessed. Thank you so much.
Thank you.
Thank you all.
Thank you. Thank you.